Good evening. I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fawver, what can I take or do to help ease my fear of flying? Well, you'd mentioned, you'd like to take something. If you're to take something, we will give people, as needed, for temporary use, medications like Xanax, also known as alprazolam. Sometimes people are given lorazepam or Ativan, but that might be a little bit more sedating for some people. So we often will choose maybe no more than a half a milligram, maybe 0.25 milligrams of Xanax or Ativan as something to take prior to getting on board. What we like about it, it's fast acting. You take it in the boarding area as they're preparing to board your plane, and then you get on the plane. Many people, when they have the fear of flying, will have difficulty with turbulence, and they interpret turbulence as being something that's highly dangerous. Well, it can be upon taking off and landing, but there are so many safety features nowadays compared to 30 years ago that it's not so much of an issue for people. But that's the thing that you could take, and you could get that from a prescribing clinician. But overall, try to educate yourself about the whole process of flying. Try to understand what turbulence is all about, what it means. Turbulence is basically airflow making your fuselage of the jet kind of a little bit more shaky. It's not unlike going over bumps if you're driving down the road and going over a pothole here and there. So a bumpy road is kind of like turbulence in the air. Also understand the noises that are occurring with the plane. I hear about a lot of people getting anxious when they hear the wheels getting pulled up and going down, and they think that there's something wrong with the plane. So educating yourself on the whole process of flying is very helpful. But the main thing you should do to get over any fear is to do it, and the more you fly, the less likely you'll have difficulty with anxiety related to flying because you'll have those experiences. But try to get educated on it, get some experience with flying, and over the course of time, you'll typically diminish a lot of the difficulty you're having with flying overall. But short flights are fine. The longer flights, you can always get the perception and the fear that you're in this tightly bound metal object. It's called a fuselage in the plane itself. But try to get enough sleep on the plane if you can sleep on the plane, but try not to drink any alcohol. That's the last thing you want to do before getting on a plane, because alcohol for many people, even though it can make you calm initially, it actually can make you more anxious over the course of the flight and cause you to not really think reasonably. So I recommend that people not use alcohol prior to getting on a plane, but the main thing you ought to do is keep flying and keep getting yourself scheduled for more trips. Thanks for your email. Let's go to our first caller. Hello, Angela. Welcome to Matters of the Mind.
Did you say Angela?
I said Angela. Hello, Angela.
Thank you kindly. I'm fine, thanks. So if you say take a 13-year-old boy, he angers quickly with the parents, is polite in school and with others. What's your first thing that comes to mind, if it's not too broad of a question, as a psychiatrist?
That's okay. That's a broad question, but that's what we will often do, Angela. We'll look at all the different possibilities, and right off the bat, you're saying he's getting along.
Real quick, sorry,
go ahead.
I apologize. I also have a second part of the question. Sorry, I just lost my thought. What's the best tactic to get the child into therapy, to convince the child to go to therapy? And go ahead, please. Thanks.
Sure. Yeah, stay on the line if you'd like, because the first thing I'd wonder if he's having trouble with authoritarian figures. but he's getting along with his peers. Okay, that sorts out a lot of different possibilities that could be even more problematic, but it could be something that's called oppositional defiant disorder, where he's having trouble with authoritarian figures, and yeah, that's going to be mainly addressed through psychotherapy or talk therapy. If he's having difficulty to the point where he's having problems in school and possibly even getting to the point of being expelled due to lack of respect, it comes down to having a trusting therapist to be able to kind of coach him through some of those difficulties, but also having a trusted friend who can point out in a very safe environment with him that it's not working out so well for him. So a 13-year-old having trouble in school and having trouble with authoritarian figures at some level knows that's a problem. 13 years old of age, you're not often thinking about the future so much, but at some point a trusted friend or a mentor is somebody who would be somebody to try to help him look toward the future. You were saying, Angela?
I'm sorry. He's doing fine in school.
Oh, that's wonderful. So that really narrows that down as well. It comes down to the oppositional kind of difficulties with authoritarian figures, correct?
Correct.
Does he have a mother and father at home?
Yes.
Wonderful. So having a mother and father at home, it probably comes down to encouraging him to have family therapy. And that's where the mother, father, the 13-year-old boy, does he have any brothers or sisters?
Yes.
Bring them all in. And I think that would take more of the pressure off of him if you make it more of a family environment. So that's what I would certainly do to try to convince him to go into therapy. I think it's wonderful that he's getting along with his peers and he's doing well in school. That's fantastic. But if he's having difficulty mainly with just authoritarian figures, okay. That's part of growing up at 13 years of age, Angela. His brain's not fully developed. And I point this out to a lot of young adults under 24 years of age, and especially adolescents. I might see an adolescent occasionally who's 16, 17, 18 years of age, and I'm telling them, look, your front part of your brain is not fully developed. You're not making good decisions because your brain is not grown. When you get to be 24, 26 years of age, a lot of these things people are telling you now are going to start making sense to you. But I try to make them aware that their brain is not fully developed, and that's not going to allow them to make the best decisions. So at 13 and 14 years of age, the things your parents might be saying to you don't make a lot of sense because your brain can't conceptualize what they're trying to say. You will later on. So there's a lot of ways that you can talk to them about that, but I'd certainly suggest getting him involved in talk therapy. Individual therapy is fine, but it sounds like he's having trouble, particularly just with authoritarian figures, doing fine in school. He's having good relationships with peers. Those are good signs overall. Does he have attention deficit hyperactivity disorder? It doesn't sound like it. People with ADHD often will have difficulty with peers at some level and have some type of difficulties in school, especially with academic kind of work. But I'd certainly suggest that he get involved in family therapy to try to understand the dynamics around that, but also give him some time. He's 13 years of age. He has a lot of growing up to do. Some of that's immaturity at this point. Angela, thanks for your call. Let's go to our next caller. Hello, Lee. Welcome to Mayor's the Mind. Lee, you had mentioned that you're currently prescribed 2 antidepressant medications, Prozac and Wellbutrin. Is it necessary to be on both? Wouldn't one be sufficient? Well, Lee, I imagine that you started out taking one particular medication, either Prozac or Wellbutrin, and it only did so much for you, and that's the reason probably a second antidepressant was added. Prozac predominantly will increase a chemical by the name of serotonin. Wellbutrin predominantly increases norepinephrine and dopamine. They work entirely differently. So it's kind of like salt and pepper. You know, if you're going to make a casserole, do you really need the salt and pepper? Couldn't you just use one? Well, it might not taste as good that way. And that's the way the brain kind of functions. When you think about what serotonin does, serotonin will give you this calming effect, and for many people it'll help more with anxiety. Serotonin projects from the middle part of the brain and goes to the outer cortex, and it gives the brain somewhat of a braking effect. It calms down excessive emotionality, decreases excessive crying. It'll make people feel less panicky, and they often will have less traumatic experiences that way. So serotonin has its role, and that's what fluoxetine or Prozac will do. Bupropion has the potency, about half the potency of a stimulant. So bupropion is a medication that increases dopamine and norepinephrine. Those are two activating, energizing chemicals of the brain, and they can help with concentration, energy, get up and go, motivation. They work in a different type of so-called phenotype than serotonin will. So a phenotype will be the symptoms in which we will try to examine for people. And some people will have the phenotype where they might do better with a serotonin medication. Some people might have a so-called phenotype where they do better with a dopamine and norepinephrine medication. So putting the two together makes a lot of sense. So Prozac and Wellbutrin work entirely differently. Think about them as being different seasonings for a casserole in terms of helping the brain function better. Now, wouldn't one be in a person's better interest? Well, if it works, yeah, that's great. But sometimes you just will find that one medication won't work so well and you have to add on another one to get a little bit of a secondary effect. Thanks for your call. Let's go to our next caller. Hello, Mary. Welcome to Mayor's of Mind. Mary, you want to know, what are the white flares in the front part of the brain? What does it mean? White flares. I'm not really clear what you might be referring to there, Mary, but I'm going to take my best shot here. You might be referring to the front part of the brain being the front cortex, and they will have white flares if you look at a magnetic resonance imaging of the brain or even a CAT scan of the brain. The white flares are basically myelin sheaths. These are the projectiles of the nerves themselves. They're called axons, and they're coated with myelin. Myelin is the insulation of the individual neurons, and myelin will give it a white appearance. So the myelin insulation on the individual projections of the nerves will give you this white appearance. You'll see it on the front part of the brain, but you'll see it in all different areas of the brain as well. That's how the brain is communicating from one part to another. Now, when we talk about myelin, Mary, we're often talking about the difficulty people have when they are shrinking down the myelin, as they will do, especially in the front part of the brain, if they use marijuana as an adolescent and young adult on a regular basis. Regular basis being 3 times or more a week. So if you use marijuana, especially under 24 years of age, it actually will diminish the myelin or insulation in your brain. That's the white matter, and that will give you difficulty later on with concentration, attention span, memory. And it's been shown that if you use marijuana earlier in your life, you'll have more difficulty with thinking and concentrating and keeping your mind on things later in life, even 20 years later. So that's why we're often emphasizing to people to not use marijuana, especially if you're under 24 years of age, because of that white matter, that myelin, especially in the front part of the brain where you use your judgment and try to make good decisions. Thanks for your call. Let's go to our next caller. Hello, Matthew. Welcome to Mayor's of Mind. Matthew, you'd mentioned that you have obsessive compulsive disorder and depression, and you feel that medical marijuana helps you bring joy in life. So you want to know my opinion about medical marijuana. Matthew, right now, with medical marijuana, it's very important to have a prescriber who understands it very well and understands the risks as well as the benefits. Medical marijuana does have a lot of different features and it has a different effects on the brain. You need to understand the potencies of it. That's the whole idea of having a marijuana card that you can, as a prescription, where you can have somebody take a good look at it. But whenever anybody dispenses you medical marijuana, they need to understand what risks you may have for it. So they need to understand the potency, the ratio between THC and CBD, and those type of factors will come into mind. So the question is, okay, if you've tried various other medications other than medical marijuana, how have they done for you? But with medical marijuana right now, my biggest concern will be the long-term safety of it. Has it been studied for long-term? No. I mean, when you have a medication come out that's approved by the Food and Drug Administration, that medication has to be studied very, very extensively versus placebo on over 100 people for at least a year and over 300 people for at least 6 months. And I've not yet seen that kind of controlled specific data with medical marijuana, and that's what we need. I want to see medical marijuana get more studied and get more extensively studied, and I want the Food and Drug Administration to treat it like any other proprietary medication, but yet they have not done that because it's something that it's processed by the Department of Agriculture and it's overseen in an entirely different way. Thanks for your call. Let's go to our next caller. Hello, Mark. Welcome to Mayor's of Mind. Mark, you had mentioned that you have a lot of anxiety and depression and you drink a lot of alcohol to level it off. Is there anything you can take to smooth out how you feel and stop drinking? Mark, I just talked to a man earlier today with this very issue, and he was having trouble with alcohol. And, oh, hi, Mark. I understand your life. Welcome to Matters of Mind.
Yeah, hi.
Good to hear from you. I was hearing some of your question already, but you tell me.
Well, that you already said it. I struggle with depression. I struggle with anxiety, and I think my drinking don't hurt it, or my drinking don't help it. I know that, but what is there anything that I can take to help me?
Lots of things you could take to help you, Mark, and thanks for even considering that, because many people, they start drinking heavily and they just lose hope and they don't expect themselves to ever have a different quality of life. So the bottom line is, Mark, when you had your first drink of alcohol, maybe when you were younger, how did that first drink of alcohol make you feel? Do you remember?
Well, when I was younger, I guess I don't really remember.
Yeah, some people do. I mean, some people will remember when they first started drinking alcohol, it made them feel really good. And they felt happy, and they felt joy, and they felt energized. If you feel like that when you first start drinking, you're probably going to have a predictor for getting in trouble with alcohol later on. So if you have your first few drinks as a young adult or even an adolescent and it makes you feel great, that's a warning sign that your brain might be kind of wired to really, really like the effects of alcohol, and you can get in trouble with it that way. But I saw a man earlier today, Mark, who was having difficulty with alcohol use, and going back, he started having trouble with sleep. And he found that alcohol at nighttime helped him sleep. I hear it about it all the time, where people will say they start having trouble with anxiety, so they started drinking alcohol to calm their nerves. And other people say alcohol makes me happy, so they start using alcohol for the purpose of helping them feel happy. But the problem is alcohol is extremely toxic, not only on the whole body, but on the brain. And in doing so, it can affect your memory, it can affect your judgment, obviously, and over the course of time, you can have a tendency to need to drink more and more to get the same effect. So alcohol is not something that is really a very reasonable medication to take in 2024 as a means of trying to help with nerves, with sleep, with depression. So what we often will do now is we try to mimic what the alcohol is doing with a prescription medication. So if you're saying that you're not sleeping very well, if you're not dealing with anxiety, you're having trouble with coping with things, for one thing, alcohol makes that worse over the course of time. So how do we reverse it? We reverse it by typically giving one of three medications. One is called gabapentin, also known as Neurontin. There are a lot of studies done on that over the past 5 years. I've been using gabapentin as a prescription for patients for about 15 years now, but gabapentin is a very, very good medication to calm down anxiety and help with sleep, especially when people have been using alcohol as a means of meeting those goals. So gabapentin or Neurontin is one option. A chemical cousin of gabapentin is pregabalin, also known as Lyrica. It's now generic, so it's a lot more affordable for people. It's more potent in many ways than gabapentin, but that can often help as well. Topiramate or Topamax is a medication that's been around for a long time for seizures. It's also used for migraine headaches and for appetite suppression, but topiramate has some really interesting effects on reversing some of the anxiety-provoked feelings that alcohol can actually cause you over the course of time. So we use those different medications. I've heard about naltrexone being used for alcohol use disorder. That can be helpful for some people for craving, but I found that it's not as helpful as gabapentin, pregabalin, or topiramate. Another medication, acamprosate, is a medication. It can just decrease your desire to want to drink. It works in a whole different type of way, and it's also known as Camprol, but acamprosate or Camprol is a medication that decreases the desire. If you're having difficulty primarily with depression and you're drinking alcohol as a means of helping with depression, I'm going to try to look at what kind of symptoms of depression you're trying to treat. Are they more the type of symptoms where you're having trouble with enjoying things, motivation, initiative? Then we might go with medications like Wellbutrin, Trintellix, Auvelity is another medication we've used more recently. As long as you're not drinking heavily and you're on the point of having a seizure from withdrawal. So if somebody's drinking heavily and they're on the verge of having a seizure due to withdrawal, we're not going to use medications like Auvelity or Wellbutrin in those cases. But we'll look at the underlying problems that might be there and that might have precipitated the underlying difficulty with the drinking itself. So there are a lot of different things you can take. Start with your primary care doctor to see what kind of options he or she might be able to advise, and then they can always refer you to a mental health clinician. Thanks for your call. Let's go to our next caller. Hello, Jim. Welcome to Matters of the Mind.
Yeah, I was in the hospital recently, and for 16 days, well, I had a surgery, but for 16 days, I couldn't eat anything, and, you can't get any sleep in a hospital.
Yeah.
And then when I get out of the hospital, and this kind of happened to me in '07 when I had colon cancer surgery, after I got out of the hospital, about 2 or 3 weeks, it seemed like I had like a post-traumatic stress event or something, and my blood pressure went up, and the doctor's been treating it. And I was thinking that maybe they should give me something for anxiety or stress. And I just got some sertraline today. But after reading the paper here with it can cause serious side effects and all that, I'm wondering whether I should take it. I just want to know what you think.
Any particular medication in its so-called package insert will refer to many, many different possible side effects. And I always point out that if we had a package insert for water, we would find that it would have a lot of potential side effects. Water in excessive doses can cause you to seizures, confusion. You can aspirate on water. So there's so many different things. Even water could cause you that could be problematic. So keep in mind when you look at those package inserts, what's most important is how the medication is going to affect you. And quite frankly, I'll hear about a person who we start on a medication on Thursday, and within 2 days, by Saturday, they're feeling lousy in different ways, and we think, it's not supposed to do that. Hey, if it's doing that for you, it's doing it for you. So what's most important with any of these medications is how it's affecting you for the bad, but also the good. Sertraline is a medication that typically is used for people who have experienced the jumpiness, the avoidance, the so-called hypervigilance, where they're on edge related to a post-traumatic stress event. And you're exactly right, Jim. You can have PTSD symptoms after having a prolonged hospitalization. We heard about that a lot with people who were undergoing the COVID pandemic and having COVID and having the treatments from that. It's a very frightening experience for many, many people when they're in the hospital for prolonged periods of time. So when you have PTSD symptoms, what your brain is doing, it's always on guard for something bad happening to you. So this hippocampus part of the brain on the side here, that's the memory center of the brain. It's right beside the anxiety center of the brain, which is called the amygdala, right up in the front part of the temporal lobe here, the yellow part. And it's closely attached so that if you're having trouble with expecting something bad is going to happen, your anxiety can be sky high. Zoloft, also known as sertraline, will increase serotonin transmission, and in doing so, gives the brain somewhat of a calming effect. It gives you somewhat of an emotional blissful effect where it just calms down a lot of those symptoms. So it can be a very good medication. I will tell you this, Jim, with sertraline, we are giving it now to pregnant women and breastfeeding women. So it's thought to be very safe for most people, but sure, there will be some exceptions out there where people have a horrific time with it because maybe serotonin is something in which they're very sensitive. Maybe they need a lower dosage versus the usual typical higher dosage of 50 or 100 milligrams that some people take. So everybody's individual, but what's most important for you, Jim, is what's the best medication for you. If it's not serotonin-based medications like sertraline, if you've had PTSD and you have a higher blood pressure, we're going to think about medications used for PTSD symptoms and higher blood pressure like clonidine, guanfacine, and prazosin. Clonidine, guanfacine, and prazosin are all medications used for blood pressure, so they lower your blood pressure, but in doing so, they decrease the excessive adrenaline firing that's happening in the brain. So in doing so, they'll give you fewer nightmares, you'll have less anxiety, and you'll be calmed down overall. Jim, there's a lot of options out there for you. Thanks for your call. Let's go to the next caller. Hello, Daryl. Welcome to Matters of Mind.
Hey, doctor. How you doing tonight?
Hi, Daryl. Doing all right, thanks.
I had a couple comments. One, I was hoping you could talk about the addictive nature of alcohol. I know a guy who he'll drink a couple shots of liquor, and before you know it, he's on a binge, drinking all night, and then for about 3 or 4 days, you don't see him, and then when you try to get a hold of him, he's home hurting so bad, his liver's all tore up, and that's one scenario. Another guy, his wife gets home, she gets her 4 24-ounce beers, and after about a beer and a half, he says she just turns into a real mean devil, and all night she's cursing everybody out, screaming at him, and by the morning she's apologizing to everybody. I mean, there's an addictive side to this thing that people drinking, they know about it. They're not going to share it while they're doing it, but why don't you explain that?
Excellent
so much,
points.
Doctor.
You described it very nicely already, but basically the addictive nature is with any addiction. If you're having trouble with getting along with other people, following something use, whether it be alcohol or any other substance, for instance, that means that you shouldn't be using it. Now, people will say, well, gee, I can just get by with 1 or 2 drinks and drink socially. Some people can't. So if you can identify that 1 or 2 drinks get you going and you end up binge drinking, what it's doing, it's changing the networking of the brain where the brain compels you to drink more and more. It's truly a disease. It's a neurobiological disturbance when people are drinking to that problematic degree. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.